The infant with essential infantile esotropia is brought by the parents while the child is held in the mother's arm. The complete evaluation of such an infant for the presence of essential infantile esotropia can be completed in a short time with little discomfort to the infant. As I mentioned in preliminaries, before progressing with the examination, it's important to obtain a careful history, then to fulfill the item of inspection mentioned before. Before doing the oculomotor examination, the general motor examination should be done. This may reveal the presence of general developmental delay or cerebral palsy. Then we observe the head posture and we report it. It's normal, abnormal head posture, poor control of head posture, or there is nodding or shaking. Then we do the oculomotor examination for the infant. Firstly, by observing if there is a nystagmus or not. Then we do a cover and cover test. This determines whether an infant prefers fixation with one eye or there is alternating fixation. Most infants object to having either eye occluded. The cover test in an infant should be done in a non-threatening way. Then we determine the angle of deviation either by the Krzyzewski test or the Hirschberg test. For my experience, it's very difficult to the angle to be determined in infants with a Brisman cover test. Then we do versions and ductions. This may be done by rotating the baby to elicit the oculocephalic reflex, or what is called doll's head phenomena. Also, for my experience, it's virtually impossible to evaluate ductions in infants because they usually object strongly to having one eye covered. Then we report the state of versions as restricted eye movements or unrestricted eye movements. Then we examine the infant for visual acuity estimation by the methods we have mentioned before. Then we do sensory tests for the infant. This, of course, is of a limited value because of the lack of reliable subjective responses. Retinoscopy is done in all infants with esotropia. A hypermetropia of +3 diopters or greater indicates the need to rule out a reflective accommodative component. Then we examine the clarity of the ocular media. Then fundus examination is performed. Examination of the fundus is essential in an infant with esotropia. This to rule out pathologic conditions such as optic nerve hypoplasia or optic atrophy and retinal tumors.